South Africa is renowned for its sunny skies and pristine beaches, but spending too much time enjoying these natural wonders could place you at risk for something else we're famous for: malignant melanoma. Yep, South Africa has one of the highest incidences of malignant melanoma in the world, the most dangerous form of skin cancer. Now, malignant melanoma develops when normal pigment-producing skin cells, called melanocytes, become abnormal, grow uncontrollably, and invade surrounding tissues. What makes melanoma so dangerous is that they grow extremely quickly. This type of cancer becomes life-threatening in as little as 6 weeks, and if untreated, can spread and start to invade other parts of your body. So what should we do to avoid it? You may have heard that using sunblock all the time puts us at risk for vitamin D deficiency, but on the other hand, we want to avoid skin cancer. So what do? Most South Africans get adequate vitamin D from just a few minutes of daily exposure to sunlight. Even when you're wearing sunscreen, small amounts of UV rays still penetrate your skin, so stick with the sunblock. Ironically though, despite our sunny skies, as many as 1 in 5 South Africans have vitamin D deficiency. If that could be you, you'll need to supplement. You may have also heard that people with darker skins don't need sunblock because their skin is naturally protected. Perish the thought! What is true is that skin cancer happens 15 times more often amongst fair-skinned South Africans, so having darker skin does have its benefits, but definitely not enough to skip the SPF aisle altogether. Having extra melanin, which gives skin its color, provides a natural SPF of around 13, but it isn't enough to protect your skin from any sun-induced damage. What's concerning in those with darker skins is that melanomas are often picked up far later than those on fair skin, and as a result are a lot more advanced and a lot more dangerous. So becoming aware of what's normal and what's not will be half the battle won. However, there are only 208 practicing dermatologists in our country, of which 165 are exclusively in private practice, which means that around 85% of our population are left totally exposed, excuse the pun, with a ratio of 1 dermatologist for every 1 million South Africans. Mole mapping is a brilliant way to keep track of the health of your moles and your skin overall, but with that kind of shortage of dermatologists, it's a bit of a challenge to get everyone to do one. Fortunately, there is a DIY skin cancer check that everyone can do, and it's as easy as knowing your ABCs, D's and E. A for asymmetry, a mark with one half unlike the other, not symmetrical. B is for border irregularities or poorly defined edges. C is for color changes: tan, black, brown, red, white, blue, any color change. D is for diameter, mainly larger than 6 millimeters. And finally, E is for evolve, as your mole grows bigger and becomes more prominent. The key point here, once again, is all about prevention. Skin cancer can easily be managed, provided it's caught early enough. So becoming aware of what's normal and what isn't is the first step in keeping your skin healthy and cancer-free.